I mean, it's sad that you can't trust the free press anymore because there's so much concern that the free press isn't truly free.
Yeah. Yeah.
That's
Well,
kind of
I
sad.
mean, we sort of know it firsthand. We've had, various press releases get into publications. Now ours are legit and they're they're actual good news, but
Yeah, nice save there.
So today's topic, we're going to be discussing what are the pros and cons to building versus buying a digital patient engagement platform. I think it'll be an interesting discussion. Obviously, we are vendors ourselves, so the general audience here might assume we're on the buying end, maybe a bit biased, but I think we're actually going to really try our best to make a good argument for why it's a good idea to build a product as well.
Now, before we do that, if it's okay, I'll just give a quick overview of like what we mean by digital patient engagement for just the folks who are not as familiar with the category. So there's this whole aspect to the patient journey, whether they're going through a surgery, a cancer journey, a chronic care episode. We give lots of paper and verbal instructions to patients that they have a hard time following. And clinical team members tell us it's really hard to keep track of how patients are doing. There's no way to easily monitor them and catch up on earlier. And so, patient engagement platforms like SeamlessMD basically provide an interactive experience to patients that they can access through their smartphone, their tablet, or through their desktop web browser. And we basically engage, monitor, and stay connected with patients across different journeys, whether that's, before and after a heart surgery, going through a cancer treatment, helping a patient manage and get monitored for heart failure. And so patients on their device or their web browser can get reminders of what to do at the right time, interactive education across the episodes. So that could be, physiotherapy videos about recovery. And then probably very importantly, we empower patients to track data and progress. So we have patients tracking, pain scores, symptoms, photos of their incision after surgery. And then our clinical team members, such as nurses, get dashboards and alerts so they can monitor a patient before and after they're in hospital, catch things earlier, prevent readmissions, all kinds of great benefit, because we know 95% of the patient journey happens when they're not in front of, their healthcare providers. So that's what we mean by an interactive patient engagement platform. And of course, as you and I, Alan, know very well, sometimes organizations are thinking about, hey, if I want to do one of these, should I buy a product like Seamless, or should I try to get our own internal team members, such as maybe IT or someone else, to build something like this? So that's sort of the genesis for the conversation.
Yep, that's a great point. I think maybe to start the discussion, Josh, let's focus on some of the pros to actually building a solution as opposed to buying one.
We're going to pretend that we're the hospital. We're
exactly.
The
Yeah,
okay.
Exactly. So one of the main pros for building your own solution, building a digital patient engagement platform, is that it's yours to own. If you build it, it is yours. So that means you hold all of the reward for building it. If I build the platform that our cardiac department uses, well, then I can actually extend it to other parts of the hospital. I can also license the technology out to other health systems, other hospitals.
Maybe you can make some money out of it, cover some costs, potentially, hypothetically. Yeah.
Hypothetically. And actually, talking about costs, it potentially costs less money up front to actually build your own solution. It does require IT time and actual resources from the IT department. But if you're an organization that is low on cash, but has the resources in IT, it could seem like an attractive opportunity to actually build your own technology, not outlay a ton of money. I mean, obviously you'll need to pay for some of the development costs and the server costs and things like that. But
right. But what they're saying is, hey, I have this team of software engineers internally in the IT department, and if I tell them, hey, stop working on these other projects, work on building the solution instead, when I look at my budget, it doesn't feel like it's changed.
Right.
They were already on staff. I'm not hiring anyone new necessarily. I don't feel like I'm paying more money to build to get a solution potentially.
Right. I think another pro for building a solution as opposed to buying is you don't have to rely on a third party. So you don't have to shop around for a vendor. You don't have to worry if the vendor is going to promise you the moon and they don't actually deliver on that. It's basically you have all of the risk and all of the liability is on our organization. So if I truly believe in our IT department, then we can make something happen. Things like what if the vendor goes out of business? You don't have to worry about that kind of concern.
I guess the other thing too is if it's truly yours, you have full control over the direction of the product. Mm-hmm. So, let's be fair, as a vendor, Ellen, like at SeamlessMD, we serve like many, many hospitals and health systems and providers. So what we can't do is make drastic changes to the platform that only help one organization to the detriment of, many, many others. Whereas if you own your own solution completely, you can be very custom in controlling the direction of the product exactly the way you want it.
Right. To an extent, because at the same time, let's say I'm building the product for our cardiac department. I completely customize it to that department, but then the larger health system says, well, let's roll it out across different specialties. You're going to have to kind of backtrack a little bit, customize for each specialty or each care plan, as it's commonly called.
Oh, and here's the other thing: to that same point, if you ever think about thinking, hey, can we spin this out as a business? Well, then you're going to have to deal with all these other health systems who have their own opinions the way a vendor does. So then right. you lose that autonomy. But if let's say you decide not to spin it out and try to build into a business, you can just leave it in your own health system. There is some things you have more control over.
Just to summarize, some of the main pros are potentially less costs up front because you're, leveraging the IT department that you already have. It is completely owned by you. So there could be a potential for, let's say, other revenue streams. Maybe you're licensing the technology. You don't have to rely on an outside vendor. Things could happen, maybe they go out of business or just ownership of the direction that you want to take the technology. So I think those are the main pros as I can understand it. Let's talk about some of the cons to building your own solution. It's kind of a double-edged sword with ownership. You're 100% liable for the product. So yes, it may be attractive at first to outlay less money to actually build the product. Could look like an attractive opportunity, but do keep in mind that requires significant development costs in terms of time, sometimes money as well. If you're gonna, get different contractors involved in the
which is very common. I've seen a lot of organizations for solutions in general. They will hire a third-party contractor or consulting shop to basically build the first version of it. So you're right. It's not always. I mean, they still own it, but you're right. There might be real capital outlay there.
Yep. I think as well, a con for building the solution, at first, it's very attractive to completely customize it for the initial pilot, the specialty that you're building it for. But then when you're scaling it, you're going to have to customize it again. You're going to have to almost start from scratch for each clinical area that you want to build it for. It also requires a lot of testing. So are patients actually going to use the technology? That requires testing, actually getting engagement rates, adoption rates. There's a lot more than just the features built into the technology for benefiting a patient to actually use the product.
Yeah, so to your point, Al, I think it's easy to underestimate the true cost of both money and time it takes to build something that works, because I can guarantee you, and this is true for every software intervention, patient engagement or not, version 1 is not going to work. Both from the product won't be good enough for your patients and providers. There's going to be so many gaps. It's not going to have the right interactions or behaviors to drive real engagement, with sick, complex patients. But the other part you're alluding to is, even if the product itself is good, the implementation learning's needed. I can guarantee you V1 of that won't be good either. And I can guarantee you that V2 and V3 might not be great either. And so the time and money it takes to not only get the first version out the door, but iterate it to the point where it's good enough.
Right.
That takes time and money.
Yeah. I think as well, often we're thinking about, building the product and, okay, we've developed the product. maybe we've gotten to V5 and patients are actually using it and like success, boom, we're done. The problem is it's very short-term thinking because there's going to be an ongoing maintenance involved in upkeep for the product as well. Coming down to kind of like what you were saying with the total cost of ownership, there's technical support needed that's ongoing. So it's almost like you spin off an entire company within the organization. Well, you're going to have to maintain that company. You have to keep up with any hardware updates, software updates, any tech support that patients need, especially if you're going to scale this across the organization. As you scale it, there's going to be an equal increase in terms of patient support needed. So ongoing maintenance is a big factor.
Yeah, I think part of it too, Alan, and I think and this is something that we only learned because we've been doing this for 8 years at Seamless with many organizations is, when we work with an organization, we assign really specifically trained team members to implement and support these programs, right? So we have a whole, what we call a customer success team. So this is a team that basically is like a project manager / consultant who project manages the implementation, best practices for how to get patients educated and supported, ongoing support to help providers and staff members get the most value of the program so that they're actually reducing length of stay and readmissions. And then there's also a whole host of clinical team members we have that actually help configure workflows with frontline staff to drive outcomes for patients. And so there's all these non-IT components to a successful initiative that you're going to have to figure out, okay, so we're going to basically figure out from scratch as a hospital how to do all those things. And we're going to have to like find non-IT people internally to then own those roles and then have those people train other people in the organization how to do these things. And so to your point, you're basically now creating an additional company inside your organization to do these things on your own. And so again, it's like maybe they're already on staff, but if you're basically running a patient engagement company inside your organization now, what are they not doing that they were hired to do? And then you're gonna have to hire someone to fill those roles. So I think at some point people realize, wait, it's not just us, paying a third-party development firm one-time fees to build a solution. It's like more than that. It's a whole initiative. And so that, to your point, total cost of ownership, I think, is very underestimated. Anyway, sorry, Alan. Back to you.
It's a great point. It's a long-term initiative, and it needs to be thought of that way. It needs to be almost thought of like we're building an entire company within an organization that's going to control and own this initiative.
Sorry. So like you said, like, okay, so bugs come up. Well, your engineers are gonna have to fix them, or providers come back saying, hey, like we need these new features, or I want to try this new workflow or all these things. Okay, you're gonna have to assign engineering resources to that.
Right.
You're gonna have to assign people for maintenance, like you mentioned. And so that's the question. It's did you if you thought that you could have like one-time effort from either your engineering team or an outside development shop to launch this, you don't realize that you need to keep all those people actually on contract to maintain this, and that's really their new job. I don't think people expect that. I think there's an assumption that, hey, we just build this one time, and that's it.
Right.
Yeah. I can tell you, if that was true, Seamless would be a lot more profitable because I wouldn't have to invest resources for maintenance and improvements and all these other things that we do to make sure our health system partners are successful.
Right. Yeah. I think it's also valuable to talk about what you'd be missing if you didn't go with a patient engagement vendor. So if you're building it yourself, one benefit of a vendor is that, like you said, Josh, they have multiple hospital clients. They work with more teams than just the one hospital or health system. And so there's learnings that we acquire from working with multiple hospitals. And so if you're building your own solution, you kind of miss out on all of those learnings that you could have leveraged if you had gone with a vendor that works with multiple organizations.
Yeah, and Alan, it's one of those things where it's so easy in healthcare, I think, to not just reinvent the wheel, but reinvent the same mistakes. Like I've lived it myself, where like we're all human, we all approach a lot of problems the same way, which means we also make a lot of the same mistakes, and that is time and money wasted. And so it's one of those things where whenever I think about something like Seamless, it's like, okay, well, imagine I'm a hospital. Not a hospital, but say I was a business, right? Seamless is a business, and we're thinking about, hey, like, should we, I don't know, buy Microsoft Word or build Microsoft Word? And it's, we have engineers on staff, and they could, we could ask them to take time out of their day to build Microsoft Word, and maybe it won't be as good as Microsoft Word, maybe it's good enough for us, but because we're a software company, we realize, well, we know that's not a one-time thing. They're going to have to like keep maintaining. There's all these things that go along with it. So definitely, like I can appreciate when I think about that, why I don't want to build Microsoft Word. It's just not worth it.
Yep. So just kind of to summarize that, like looking at the total cost of ownership. So yes, you do own the product. It is yours. You have all of the reward, but also all of the risk associated with that. But it is also a long-term initiative. So there's going to be ongoing costs involved. There's going to be maintenance. There's going to be patient support. Again, there's some people costs involved. So actually training the staff, implementation, and making sure that everybody's happy with all the features that are in there, and also some of the missed opportunities. So not being able to leverage some of the learnings that a full vendor could bring, because they've worked with multiple organizations. They've made the same failures, they've made the same successes, and they can kind of combine all that together for your implementation. I think that leads us in really well to the pros.
Can I add a few more? And I don't mean to harp on the cons, but
yeah.
A bit more points to share. I think one of the things that I've seen happen in the healthcare system is that, like, let's say an organization tries to build their own thing and it doesn't work out quite well. And part of the reason why it doesn't work out is because they don't have the experience on how do you actually educate a patient on why they should adopt this, or it's not very user friendly, right? Because it takes a lot of iterations to make it useful, or it doesn't drive an outcome because, again, the first few versions are not, right? I mean, we've been doing R&D for 8 years on what we do full time to get to the point today where it's driving an outcome. And so often what happens is it fails, and then providers lose confidence that anything like this would work. They're like, well, if it didn't work when we try to build it, so like, why would it ever work again in the future? And so it almost stifles that innovation internally, because there's a lack of faith now that this sort of engagement with the patient actually works, right? Or could work, despite all kinds of evidence outside that says it does with the right solution. So that can hurt progress around innovation. I think that's one thing. And so, anyways, I think the opportunity cost of not being able to then get back on track with this innovation, and taking a longer time to get there again internally, that's a cost, that I think is often missed.
Yeah, absolutely.
Like failure delays the success that you should have gotten the first time, is what I'm trying to say.
Right. If you find that V1 is not successful, you're going to have a lot less confidence that the technology in general is going to be successful.
I mean, what comes to mind, I won't go into names, but I remember we met this health system where they actually got on stage and talked about how they had a field initiative where the hospital spent 6 figures hiring a development shop to build their own patient engagement solution that they could own. So 6 figures, like many, many, many months of this third-party contractor building solution. And then when they finally started using it, I think they said less than 20% of patients actually adopted it. And then within the first 50 patients, they basically just gave up on the initiative.
Right.
And it's like, gosh, like that's a very expensive lesson when it comes to time and money. And again, like, was the product like good enough? Maybe, probably not, right? Maybe good enough to get people enticed, but not good enough to actually work. But the bigger problem is, I think, the implementation. Like, it's not like the development shop knew how to implement this. They're just developers, just being told to develop something. They're not project management specialists or change management specialists. And so the health system was just kind of guessing what to do. Anyways.
Yeah. Now let's shift to talking about some of the pros to buying a proven solution. And obviously, this is kind of the other side of the coin from the cons to building a solution. But one of the first ones that comes to mind is you can start immediately. It's, lower costs, lower risk, because you're presumably using a vendor that does this repeatedly. So it's out of the box. Maybe there's clinically validated digital care plans already built. And sure, you can customize it for your specific needs, but presumably the care plans that are already built are proven to achieve a high patient engagement and improved clinical outcomes. And there is results on the technology.
Said it well, Alan. I noticed your comments on that.
Speechless from that. Yeah. Would you have anything to add in terms of?
Actually, no, I apologize. I actually something did come to mind. And I think that is when you're trying to pitch this internally. So if I'm a hospital and I'm, an executive or an administrator or a digital lead, and I'm saying, hey, I want to move us forward in the 21st century, going digital, especially with the pandemic. We need to do a better job of engaging and monitoring patients remotely with technology. But at the same time, I need clinician buy-in for this. I need staff buy-in for this. And I can tell you, like your top clinicians, your department chiefs are going to say, well, what's the evidence around this? Mm-hmm. And if you go to them and say, well, actually, we're going to hire a development shop to do this or ask IT to do this. But like it could work, right? They're going to say, well, come back to me once you have real clinical evidence that your solution does work. Right. Because, I don't want to be your guinea pig.
It's not a risk.
Yeah. But the only way for you to get that evidence is to actually get them to use it. So catch 22, right? Maybe you can convince one department to do it with you. Like, let's say you convince orthopedics to do it with you, right? And then you have this evidence now. And then you go back to your cardiac chief and say, hey, orthopedics use this. It's kind of working. And your cardiac chief will say, okay, what evidence do you have for cardiac?
Right.
And then you're going to say, well, you're supposed to buy evidence. Anyways, my point is that it's not just the fact that if you use a validated solution, you can be personally confident that it works, but it's more that you want your team confident that if they're putting in their time to support you on this initiative and put it into their workflow, that they have confidence that it works too. And that reduces your risk as an organization, and yourself as an individual stakeholder championing this initiative reduces your risk personally and maximizes your opportunity for success personally, and then for your department, your hospital. I think that's the big thing.
Absolutely. Another pro for buying a solution, like we mentioned with the cons to building one, is there is that ongoing maintenance, ongoing enhancements to the platform. This is literally the company, that's what their focus is. Their focus is on the patient engagement platform. So improving it based on, patient engagement rates. Can we actually improve the processes that are in place to have more patients adopt the technology, have more patients use the technology, and have more patients actually benefit from the technology? So buying a digital patient engagement platform allows you to access new features, new digital care plans that are used by other health systems that are validated, and the vendor will be and is exclusively focused on building the product and enhancing the product and continually improving the product for your benefit.
Yeah, and I think to your point, the big part of it is when we're talking about lowering risk and increasing probability of success, it's a fact that it's not just the technology works, but it's all the other services, right? So the fact that our customer success team actually helps you implement best practices for how do you get patient adoption, or what are the right workflows for monitoring a patient, or how do you actually engage certain maybe departments or staff members who aren't as engaged with this initiative, what's been working for other organizations. So there's all that ongoing kind of support from the services side that to actually make the program successful, because it is more than the technology, right? I think every hospital that's gone through an EHR implementation knows that it's not just the technology of the EHR, it's all the services that you need to make it a successful initiative. And the fact that, you don't have to figure that out from scratch, or the fact that you don't have to find people to do it, right? In some ways, I'll be honest, as a business owner myself, right? In some ways, sometimes it's just easier to spend money to know what I'm getting. I can be for example, it's like, yes, like I could send Alan to law school and get a JD to like be the lawyer. And maybe like, I think, well, over the next 50 years, it's cheaper if I do that than like paying like gazillion bucks an hour to our law firm. But it's like, if I want this contract by next week, like who am I going to go with? Right. In the same way, it's like from a time point of view, if I'm saying, hey, our hospital wants to implement a digital patient engagement platform by Q2 of this year, and I want to be confident that it works, and I have a goal in mind, that you kind of want to go with something you can be confident works.
Right.
And I think that's where, it's more helpful to go with something that's proven. If you have this 50-year horizon and you have time to spare, it's like, yeah, I guess you can kind of like,
sure,
like roll the dice,
Right. And I think confidence is key as well. I don't know if I would trust my abilities with law, for instance.
What if we sent you to Harvard Law School? Huh?
I mean, if you want to do that, yeah. But yeah, to your point, it's less time required, less risk going with an actual vendor, continuous enhancement, continuous maintenance. Like you mentioned, there's a team of service professionals at the company who are there to leverage the learnings from the network. They can share those best practices. They can explain, the exact circumstance that we're going through. Maybe it's getting just buy-in internally. Well, there might be a playbook on how to do that that's worked well at other organizations that they've worked with, and they can share those with you as well.
And then I think also, oh, sorry, go ahead, Alan.
No, go for it.
I was going to say, and then not just the strategic services, but just the raw technical support services. I mean, when you're doing your own and patients have questions about it, they forget how to log in, or there's a technical question from the patient. Who's managing that? Are you saying IT now has to manage that? Are you saying your frontline nurses and physicians have to manage that? Or what if, frontline staff, your providers have a question about your dashboards or things like that?
Right.
Are you saying that they then have to contact IT for those questions? So now you're creating an internal, like ongoing, like IT support team for any like just more basic like day-to-day needs. No one thinks about that ahead of time, right? And so there's that. Is even not even more than the strategic services, like literally your day-to-day operations of this platform, like who is owning that,
right?
And being educated on that, like that's a whole other thing too.
Yeah, exactly. And then just the last point that I would say for a pro of buying a solution is the confidence, again, the expertise that the vendor might have. So Josh has already mentioned, but SeamlessMD has 8+ years of research and development. So you can be pretty sure, based on the evidence that's out there, that we have somewhat of an expertise in the domain of patient behavior change and patient engagement. And so kind of that confidence that you're gaining. So you're able to launch and maintain an actual effective product right from the get-go.
And the last thing I'd add, Alan, is just we kind of touched a bit on it earlier, but it is access to the customer and partner network of the business. It's the fact that all the time we'll have healthcare system customers saying, hey, like, how is this other organization achieving those results on the platform? And we can share that. Or often we have organizations who are actually getting on a phone call together and sharing best practices, or sharing digital care plan elements on our platform and collaborating on the platform. And you can't do that if you're siloed on your own doing your own thing. And so the fact that you can like get the best thing available, collaborate with other partners, get results faster. Like really, those are the big things. I mean, it's about outcomes. That being said, though, Alan, I mean, I think you're probably getting to this. There are cons. There are definitely cons to working with a vendor partner.
Yep, for sure. First con that comes to mind is the direct inverse of the pros to building it. You don't own the product, so that means you can't necessarily choose exactly the features that you want to put into the product that'll fit perfectly well with your specific care plan or your specific patient population. So you don't own it. You don't necessarily have full control over what's going to happen with the product. I think
We've all been there where, like, maybe we wish that vendor partner prioritized our requests on the product roadmap, right? And if you're able to have your own team control that, you can literally prioritize the way you want. You can get that feature you want right away.
Right.
But when you're one of, like, hundreds of other hospitals working with a vendor, there's a limit to what you can push for.
Yeah, I think also, and this is probably the biggest driver of a con for buying a digital patient engagement platform, and it's potentially more expensive long term. But again, we've kind of highlighted the ongoing cost, the maintenance cost, the fact that you almost have to build a full company within the organization to keep the product running. But potentially, if we're scaling this across the health system, it may be a bigger price tag up front. But again, you have to know what are you getting with that price? What are the values that are?
Yeah, and I think that way to look at it, Alan, is like, if all you wanted was just to be able to say you had a patient engagement solution,
features, yeah,
right, and you didn't really care, are patients actually adopting it? Is it improving outcomes? Is it lowering costs for us? Are we actually delivering better care? If you didn't care about that stuff and you just wanted to say, hey guys, we have something, I think you can find a way to make it cheaper from a cost point of view.
Right.
But if you're saying, hey, no, like, we're actually investing in this to get a real business outcome, a clinical outcome, real adoption, market differentiators, I think it'd be very tough to, or you would have to be an extreme outlier with just an unexpectedly, like, well-run ship with like all these team members that can actually, manage this along with everything else they're doing.
Right.
I have a hard time seeing a situation where you can actually do that more cheaply. But yeah, if you just want to be able to say you have something, I mean,
then it
yeah,
could be,
you probably could, like, find a way to do it cheaper.
Yeah.
But I don't think most organizations are the type that just want to be able to say on paper they have something.
Right.
I mean,
yeah. I think another con for buying a digital patient engagement platform is that there are so many vendors out there that it could be unreliable. You don't know what you're getting unless you really do your due diligence on the specific vendor that you're looking at. One kind of shameless self-promotion that I'll put out there for our own podcast. On episode 33, we talked about how to evaluate digital patient engagement vendors and platforms, and we go above and beyond just the surface kind of table stakes of features and price and all that, and really get into the details, like, do they have experience implementing, and what's the actual playbooks look like for all the different factors involved. But my point here is I think it needs to be said that not all partners or not all vendors are created equal. There's definitely some out there that maybe will promise you, hey, we can implement something in a week, and then you find out 8 months later they're still not implemented. So there's definitely a level of due diligence needed in choosing the right vendor.
Yeah, no, that's true. I mean, you're right. You pick the wrong one, that is time, money down the drain. And you have, unfortunately, there's not a lot of, you won't be able to know everything about a vendor when you're picking them. But yes, Alan, great plug. We definitely have a good resource on at least how to consider evaluating partners, and hopefully people find that helpful.
Right. Do you have any other cons for buying digital patient engagement?
I think you had one more good one. Before we get to
the one con that sticks out for me is, like, you might have to work with myself or Josh. I mean, that's a con right there.
Yeah, you know what? I think you should just build your own.
I think it really comes down to the true value that you're looking for. So kind of back to that, how to evaluate digital patient engagement is, like, what's the actual benefit that we're looking to achieve? Are we looking to achieve outcomes and actually get a good ROI on what we're putting into building or buying a product? And so I think, if you're truly looking for, let's make an investment that'll actually pay off for better patient care, more patient-centered care, and actually drive benefits for our patients, then I think obviously I'm biased, but I think buying the right patient engagement platform can make all the difference.
Alan, I great point. And I think, I mean, honestly, I'm thinking about what we're talking. I'm trying to think like how many examples are there of companies or organizations where they basically created their own version of something that really wasn't in their field. Like, yes, I get patient engagement in the healthcare field, but being a software company is a totally different line of work than being a healthcare delivery company, right? They are quite different. And I'm trying to think of examples in the world where organizations have successfully spun out companies whose work was pretty different than their core business. And the only example I could really think of right now is, Amazon built all their own data centers and services for Amazon, and then spun that out into Amazon Web Services, which is now could literally be its own separate publicly traded company if it wanted to be. And they've been very successful at being, a cloud-based provider for like the government and all these, and Netflix and all these other big organizations. But besides that, like there really aren't that many examples. And I mean, Amazon's an outlier. Like it's an outlier. I can't think of too many other situations where there's been successful thing. And again, like you would have to truly spin it out and make it its own company. And I can tell you, like, there's a lot of patient engagement companies. Unfortunately, it's a big graveyard of digital patient engagement companies, unfortunately, because of how hard it is. And so you have these companies that literally they're trying to do this 24/7 as a business who can't succeed. I feel like that should be some sort of data point for thinking,
if we were
building a patient engagement solution is kind of hard. Right? Like if we're not even focusing 24/7 on it, and a lot of people that do aren't able to make it work, that kind of tells you something about how hard it is.
That's a great point. Yeah.
Sadly, like I don't wish that for anyone, but it's hard.
So, Josh, what do you think for, if you are a health system or hospital, what are kind of the main takeaways here? What would you say are the most important things to consider when you're trying to decide?
Yeah, I think there's a time and place for everything. So I think, Alan, what I like about like our culture here is that Seamless is not trying to sell stuff. We really view it as how do we educate an organization on the buying process, right? And how do we actually have a real conversation about, is Seamless actually right for you, right? Whether that means we are right for you as a vendor partner because you want to pick a vendor partner, you've already decided that, or whether we're right for you in terms of building versus buying, right? And if we're not the right fit for whatever reason, then we definitely don't want using SeamlessMD. And so if we're talking about building versus buying, I think it comes down to like, what is your situation? What are you trying to achieve? And I think the simplest way for me to think about it is if all you care about is having something, right? You don't care if it really works that well or not. And you have a team that has like capacity internally and is like motivated to just like do something. I think go for it. I don't think there's any harm in that. I just think go into it with eyes wide open about that's going to be probably a lot more time and money and people than you think it is. And then I think honestly, if I'm a hospital organization, I would have the open mind that like, you know what, we might be willing to try this on our own, but if we really want this to drive business outcome or hit scale or, get, move quickly, you do want to at least keep in mind that whether now or later, you might want to look into a partner to do this. But I don't think it's necessarily a bad idea to try it on your own just to see or just see if there might be interest in it internally.
And then I would just add an earlier point that you mentioned, but if it's not successful, how do you set the expectations so that internally we don't just completely shut the idea down for future innovation? So if maybe the first attempt at building a solution doesn't work out, how do we make it so that internally we're not going to just never get a patient engagement solution again because it didn't work one time? So manage the expectations as well. If that is the route you're truly going to go, and you have, let's say, the IT resources available, and that's you're looking at, let's build these features for our patients. then just make sure that you're managing the expectations internally as well, because you don't want to shut down this idea, because it is definitely the future of patient care is going to be digital. So
Absolutely, 100%.
okay, awesome. So I think that was a pretty good conversation on the pros and cons of building versus buying a digital patient engagement platform. You'll notice, obviously, some of the pros for building a platform are the cons to buying a platform, and vice versa. But I think it really does come down to what are the goals of the organization? What are the goals that we want for our digital patient experience? Take from that what you will. Obviously, we are a vendor, so there's going to be a slight amount of bias in this conversation.
There's a big echo chamber at the company. We just like, you know.
Exactly. But at the same time, as a vendor, we are faced with similar decisions. Do we build this software that we need to use, or do we buy an outside software for whatever the case is? There's obviously some good thought process and some good decision making that needs to go into those decisions as well. So
thank you, Ellen. Wonderful discussion. I really did appreciate it.
Amazing. Thanks, Josh. Until next time.
Until next time.
See ya.
Yeah.